HIV/AIDS was most likely passed to humans a long time ago. It is believed that it came from a type of chimpanzee in Central Africa and was most likely passed to humans when they hunted for them and they came in contact with the infected blood of the chimpanzee that had the virus. There are about 37.6 million people across the globe with HIV. 1.7 million are children younger than the age of 15. Of all the new HIV diagnosed cases in 2019, 69% were among gay and bisexual men, 23% were among heterosexuals, and 7% were among people who inject drugs. At the beginning of HIV, the viral load will skyrocket while completely depleting your CD4 plus T cells. Your body will start to fight back, and the CD4 plus T cells will raise up a little, and the viral load will decrease. At this time, you have the virus, but you're asymptotic. Then the viral load goes up again, and it becomes AIDS. HIV can be treated to an extent. You can never become fully clean and with no viral load, but you can manage it well. If HIV is treated, you'll have a plethora of CD4 T cells and little viral load. However, if it's not treated, your immune system will deplete until it's nothing and your body's overwhelmed. Now you may be wondering, how is HIV related to AIDS? HIV stands for Human Immunodeficiency Virus, while AIDS stands for Acquired Immunodeficiency Syndrome. HIV becomes AIDS when your white blood cell count, or CD4 plus T cell count, reaches less than 200 cells per cubic millimeter of blood. Stage 1 is called acute HIV infection. During this time, you'll have a lot of HIV in your blood, and you're very contagious. Some people will feel sick right after being infected, or not at all. Some of the symptoms may include rash, muscle aches, chills, fatigue, mouth ulcers, night sweats, swollen lymph nodes, and fever. Stage 2 is called chronic HIV infection. During stage 2, they are in clinical latency. HIV is still active but reproduces at very low levels. With no medication, this stage might last a decade or longer. People that take HIV medicine as prescribed may never move into stage 3. Stage 3 is called AIDS. Again, this is when your cell count is below 200 cells per cubic millimeter of blood. If people go untreated once they reach this stage, then they will survive an average of 3 years. If you reach the stage of AIDS, there is a very low chance that you beat it without preventative or treated measures. There are many ways that HIV can be transmitted. I'm only going to cover the main ways that it spreads. Some of the most common ways are through blood, semen, preseminal fluid, rectal fluids, and vaginal fluids. If you are a sexually active person, you may want to make sure your partner isn't infected with HIV. Another very common way that HIV is spread is through breast milk. It is recommended that women with HIV don't breastfeed their infants, as the risk of it being transmitted to them is high. These women will have to bottle feed their children and may never get the chance to breastfeed them. For people that inject drugs, they must never share needles, syringes, or other drug equipment. Doctors educate people that if they don't have access to a new needle, then they should at least clean the needle they're going to use with bleach. Speaking of needles, you could contract HIV by getting a tattoo if the needle wasn't properly sterilized. People can also acquire HIV through a contaminated blood transfusion or a contaminated organ transplant. That's why it's important to know if you are HIV positive, so you don't go and donate a bunch of blood stating that it's, quote, clean blood, unquote, and then give a bunch more people HIV. There are a lot of myths out there. HIV is not transmitted by air or water. It's not transmitted by saliva, sweat, tears, or even kissing. You also can't contract the virus through insects or pets. The last myth is that you can contract it through sharing toilets, food, or drinks with people that are HIV positive. Now, there are a few ways to protect yourself from HIV. The first way is to wear a condom when participating in sexual activity. Learn the correct way to put the condom on, whether it's male or a female type condom. You should also use a water or silicone-based lubricant to help prevent the condom from breaking. There's also a pill that you can take. If you take the PrEP pill as prescribed, it will lower your risk for HIV infection. You may want to be taking this if you are someone that is very sexually active. The pill is not as effective if it's not taken as prescribed. Make sure you are taking it when you should, or else it might not work. Another very simple way to protect yourself from contracting HIV is by choosing to not inject drugs. If you're going to inject, make sure it's a new needle or it's been properly sterilized if you must use that same needle. It's a good idea to educate yourself on peers around you that may have the virus with whom you're sharing the needle. Now, what are the steps you can take if you're diagnosed with HIV? The first step you can take is to get yourself a primary care doctor. Meet with him or her and be open with them. They're there to help you. With your doctor, you will determine what medication is going to work best for you to keep your viral load down. After you get a doctor, it's not enough to just say you're going to take the pills and keep getting it refilled. You need to continue to make follow-up appointments with your primary care doctor, and it's important that you keep those medical appointments so they can keep an eye on your viral loads and make sure the virus isn't continuing to grow. At each appointment you go to, they're going to check your viral load, meaning they're going to see how many infected cells you have in your system compared to the CD4 plus T cells. They will look for any other issues that might be there, and they will talk about your sexual activity with you to make sure it's been safe and you haven't infected anybody else. Now, last but not least, if you do end up contracting HIV in your lifetime, don't worry or stress out. There are plenty of measures you can take to ensure that you can continue to live a happy and healthy lifestyle. You'll still be able to do all of the things that you love if you do what's necessary to keep your viral loads down. Thank you.